Good morning, afternoon, or night, Mr. Madelone. This is Antonio Roche presenting on Vyvanse. So we see some books here, of course. Okay, so the diagnosis of Vyvanse. The brand name is actually Vyvanse, and it is a stimulant prescription drug that's used to treat ADHD and BED, or attention deficit hyperactivity disorder and binge eating disorder. Vyvanse is an amphetamine, which I'll talk about in a second, so I won't cover that. It's a picture of classic nerves and someone studying. Some of the features of Vyvanse. Like I said earlier, it belongs to the amphetamine drug group, and amphetamines are psychostimulants that raise levels of dopamine and norepinephrine in your body, which can lead to a higher sense of concentration. Now, dopamine is necessary for concentrating and long-term periods of attention, and norepinephrine is essentially adrenaline for your mind, which raises its alertness. Vyvanse in itself comes in capsules and is used to treat ADHD for all ages, as well as adults, BED in adults, for those who are 18 and up. The history of Vyvanse. Well, it was developed originally just for the sole goal of, treating ADHD, and it was initially marketed as a different, as a kind of stronger Adderall, because for Adderall you would be required to take multiple pills a day, and Vyvanse, the idea was that kind of taking a lot of pills a day was a hassle, so Vyvanse was marketed as Adderall that you only take once a day, essentially. And it was approved for ADHD treatment for kids in 2009, for adolescents in 2010, and adults in 2012. As a kind of side effect, initially, it was discovered that a lot of patients felt a lack of appetite after taking Vyvanse. And so they did a little more research, and they discovered that it was good for treating BED. And so in 2015, it was approved by the FDA. Initially developed by Shire Limited Liability Company. It was derived from the ephedra, plant molecule, ephedrine. Now, ephedra plants have been used for a long time by doctors for different reasons, like kind of making you awake and checking your pulse, making it stronger, and as well as your blood pressure. But it's also been linked with cardiac issues, like problems with brain function as well. And it has kind of dangerous side effects. So the FDA approved this as a Schedule II controlled substance, which means that you can abuse it, and if you abuse it, it's dangerous. Those are the ephedra plant. It's an interesting kind of plant. Mostly grows in Asia. Now the chemistry. Okay, the chemistry is, like I said before, it's an amphetamine. Now, so the capsules come in 10 milligrams, 20 milligrams, 30, 40, 50, 60, and 70 of lisdexamfetamine, dimesylate, of course. And yeah. So the molecular formula for lisdexamfetamine dimesylate is carbon 15, hydrogen 25, nitrogen 3, and oxygen. And it looks a little something like that. Now, pharmacodynamics. Vyvanse brings about kind of, it says modest, but yet ambiguous improvements in cognition, which can be for memory, for long-term memory, and as well as attention in some patients. And it is proven to decrease appetite, to increase attention and decrease appetite. And I can tell you that the reason I chose Vyvanse is because I take Vyvanse, and the lack of appetite is, initially when I first started taking it, it was in fact a factor, let's say. But the pharmacokinetics. Now, absorption. It's a capsule, so it's taken through the mouth, usually before breakfast. and then it gets the lisdexamphetamine dimesylate is absorbed into the gastrointestinal tract, which basically it gets absorbed into the digestive system, and after that it's excreted. By the way, I didn't put that in there, but it lasts about 12 hours. This heightened sense of concentration and lack of appetite. And after 12 hours, though, it gets excreted. About 96% is in the urine and 0.3% in the feces. So it does stick around in your body for a while. Has some side effects. The side effects of this drug are kind of rough. Some common ones, if you're struggling with ADHD, if you're taking Vyvanse for ADHD, can be anxiety, loss of appetite, decreased appetite, nausea, diarrhea, trouble sleeping, dizziness, upper stomach pain, dry mouth, vomiting, irritability, and weight loss. And if you're taking it for BED, you could have dry mouth, constipation, trouble sleeping, feeling jittery, have a decreased appetite, have anxiety, or an increased heart rate. The biggest ones, however, since this was initially, since the ephedra plant was used for a long time just to stimulate kind of the heart, this drug works around that. And so the heart-related side effects can be the most dangerous, also because you're just dealing with the heart. So if you have any other medication, if you're on any other medication that messes with your heart, say, or if you're pregnant, it can be really dangerous to mess with Vyvanse because it affects your heart rate. It'll get it going and beating very quickly at times, and it's kind of a mess. So it can cause sudden death in people who have heart problems. It could be sudden death in like a stroke or a heart attack if you have high blood pressure, or if you have a lot of cholesterol, especially. That's super dangerous. And just in overall, just high blood pressure and heart rate, which if you have, you should notify your doctor immediately. You should not take Vyvanse if you have taken an antidepressive medication called a monoamine oxidase, or MAOI. If you're sensitive, allergic to, or had a reaction to any other stimulant medicines, if you have a family history of heart disease, or defects or high blood pressure, or even if you have a history of circulation issues, because this is all based around blood flow. That is my bibliography, and yeah, I can't go any further. That's it. Thank you, Mr. Madeline.